All right, let's dive into this deep dive on Panchakarma. We've got, you shared with us this SOP manual, the Standard Operating Procedures Manual from the All India Institute of Ayurveda.
Right.
It's pretty cool to get this in-depth look into how, this ancient practice is actually like practically applied.
Yeah.
And I was looking at this manual, and it's like this is a revised edition. It says it's based originally on a practical handbook of Panchakarma procedures. So we're going way back.
Yeah, I mean, this is the authoritative document. It's really interesting.
Yeah, so maybe for folks who are tuning in for the first time, can we just, before we get into the nitty-gritty, can we just take a step back?
Sure.
What is Ayurveda, and how does Panchakarma fit into that big picture?
Ayurveda is means the science of life, and it originated in India. It's a holistic healing system, and I think the really interesting thing about Ayurveda is that it is a personalized approach to medicine, right?
Yeah.
So it recognizes that each of us has a unique constitution, and that's made up of these vital life forces called doshas.
Okay.
And when these doshas are in harmony, we experience health and vitality, and when they're out of balance, that's when disease can arise.
Got it.
So that's kind of like the big picture of Ayurveda.
So it's like a personalized roadmap to health, basically, or well-being.
Precisely.
Yeah. Cool.
And Panchakarma fits into that in that it is a set of 5 purification therapies that aim to eliminate accumulated toxins and restore balance to those doshas.
So it's like hitting the reset button.
Exactly.
Okay, awesome. So 5 therapies, right?
Yeah.
And this manual starts out with a snahana, which is oleation. I'm guessing it's not just like an art technique. It's a little more involved than that.
Right. So oleation, it's like a lubrication of the body.
Okay.
And this is done by administering different oils and ghee, both internally and externally. And this is done as a preparation for those more intensive purification therapies to come.
I see. So what's the logic behind that?
So imagine like accumulated toxins as kind of stubborn grime, right, clinging to your system.
Yes.
Snahana is like, it helps to soften and loosen them up so they're easier to flush out during the subsequent therapies.
Okay.
It's like prepping the ground, right?
Yeah.
Before planting the seeds of well-being.
Okay. So you're softening, loosening those things up. So what kinds of oils, what kind of ghee are typically used?
Yeah, so the manual lists a variety, including, so you've got medicated ghee and plain ghee for internal consumption.
Okay.
And then for external application, sesame oil, Mahanarayana taila, Shirabala taila, Dhanwantara taila, Bala taila, just to name a few. And these oils are chosen because they penetrate deep into the tissues. They nourish the body. They help those toxins mobilize.
So it's not like one size fits all in terms of the oils you'd pick based on.
Right. The choice of oil is tailored
Okay.
to the individual's constitution and imbalances.
Got it.
The manual also details the administration process for Snahana, and it emphasizes a gradual approach.
Okay.
So starting with a small dosage, increasing it over several days, always monitoring the individual's response and their digestive capacity.
So I'm starting to see like a theme here, which is this personalized care, this attention to detail.
Exactly.
It's not just like you apply a remedy. It's like you understand the person and what their specific needs are.
Absolutely. And there are certain conditions where Snahana wouldn't be recommended. Like for instance, obesity is listed as a contraindication.
Oh, okay.
As well as specific conditions where the digestive system might be compromised in some way.
Makes sense. Safety first, right?
Exactly.
So let's say you're undergoing this Snahana. Are there any like lifestyle adjustments or precautions that are involved during that stage?
Yeah, absolutely. Rest is crucial.
Right.
Because the body is working hard to process those oils and loosen up the toxins.
Okay.
The manual also emphasizes avoiding daytime sleep and adhering to specific dietary recommendations.
So it's like giving your body the space and time to do its thing.
Precisely.
Okay, cool. So we've got this Snahana, which is like this foundation.
Right.
What comes next in this Panchakarma journey?
So once the body's prepped with Snahana, we move on to Swadhana, which means suit. And logic here is brilliant, right?
Okay.
Remember those mobilized toxins we talked about?
Yeah.
Swadhana helps to further liquefy them
Okay.
and guide them out of the body through the sweat glands.
Oh, so we're like turning up the heat to really get things moving.
Exactly. And the manual details various types of Svedana, including Tapa, Ushma, Upanaha, and Drava.
Oh, wow. So many options.
Yeah.
I'm guessing, again, like the choice of Svedana technique would depend on the person, right?
Precisely. Ayurveda is all about personalization.
Okay.
And just like with Snehana, there are contraindications for Svedana as well.
Okay.
For instance, if someone is pregnant or experiencing a fever, Svedana might not be appropriate.
Got it.
It's about understanding the individual's current state and ensuring that the treatment is both beneficial and safe.
Okay, so I want to dive into a specific one here.
Yeah.
So the manual has a whole section dedicated to Bashpaswita, the steam bath.
Right.
So tell me everything.
So Bashpaswita, think of it as a deeply penetrating steam bath, but infused with the healing power of herbs.
Okay.
So you step into this a steam chamber. It's called a Vajpaswita yantra. And the idea is that these therapeutic vapors can work their magic, right? They open up your pores. They draw out those toxins.
So therapeutic and relaxing.
Exactly.
What kind of herbs are typically used in that?
Yeah, so it mentions a variety of herbs. You've got bilva, agnemantha, arjuna, shunaka, patala, and gambari.
Wow.
And again, the specific herbs are chosen, based on the individual's needs
Okay.
and the desired therapeutic outcome.
So even within that Bashpaswita, there's still this element of like.
Absolutely.
Okay, cool.
And what's really fascinating is that the practitioner will closely observe, the patient's response to the steam. They're looking for specific signs that indicate how well the treatment is working.
I love how like this ancient system combines this deep understanding of the body with like careful observation and personalized care.
Exactly.
That's very cool. So we've got Snehana, which is like that foundation.
Right.
Then Svedana, and specifically the Bashpaswita. What's next in this Panchakarma process?
So now we move into the main purification therapies. We start with Vamana, which is therapeutic emesis.
Emesis. Okay, so we're not talking about like your average stomach bug here.
Yeah, definitely not.
Okay.
So emesis is the medical term for vomiting.
Okay.
But in the context of Panchakarma, Vamana is a controlled and purposeful procedure that's used to eliminate aggravated doshas that have accumulated in the upper gastrointestinal tract.
Okay.
So
what doshas are we primarily targeting there?
So Vamana is specifically used to address imbalances in Kapha dosha.
Okay.
And you probably remember Kapha dosha is the dosha associated with grounding, stability, lubrication.
Mm-hmm.
And so when Kapha is aggravated, it can manifest as congestion, lethargy, weight gain, respiratory issues.
Okay, so you're essentially expelling that excess kapha that's causing this imbalance. I'm imagining this procedure is a little more involved than just, throwing up.
Yes, you were right.
Okay, so tell me about it.
So the manual outlines a very specific procedure. First, the individual is given a combination of milk and ghee,
Okay.
which helps to lubricate the digestive tract and prepare it.
Okay, so prepping the terrain.
Exactly. And then specific emetic herbs are administered to induce vomiting. And, the practitioner closely observes the individual, and they're watching for the vega.
Vega.
Yes, the Sanskrit term for the urge to vomit.
Okay.
And the timing and intensity of the vega are carefully monitored.
So it sounds like there's a lot of skill and precision involved here.
Absolutely.
You wouldn't just like hand somebody a random herb and say, okay, go for it.
Precisely.
Yeah.
So Vamana should only be performed under the guidance of a qualified and experienced Ayurvedic practitioner.
Right. It makes sense. So that's Vamana, all about addressing the imbalances in Kapha dosha. What's next on this Panchakarma lineup?
So next up is Virachana.
Okay.
And this focuses on the lower digestive tract.
Okay. So if Vamana is for Kapha, what dosha does Virachana target?
So Virachana is primarily used to balance Pitta dosha.
Okay.
And you probably remember Pitta dosha is associated with fire, transformation, metabolism.
Got it. And how does Virachana work? Is it similar to Vamana in that it induces a purging process?
It is. But instead of inducing vomiting, Virachana involves the elimination of toxins through the bowels.
Okay, so it's like a targeted cleanse of the lower digestive system.
Yes.
And what does that procedure involve?
It's similar to Vamana in that there's a preparatory phase that involves Snehana and Svedana,
Okay.
which we've already discussed.
Right.
And these steps help to soften and mobilize those toxins, making them easier to eliminate. And then specific purgative herbs are administered to induce bowel movements.
So we're essentially guiding those toxins out of the system through the bowels.
Precisely.
Okay.
And just like with Vamana, the practitioner closely monitors the individual's response. They're watching for the urge to defecate, which is also referred to as the vega.
Okay.
It's all about working with the body's natural rhythms.
It's fascinating how the system combined like these powerful herbs with such a deep understanding of the body's, innate intelligence.
Yeah, it truly is.
So Virachana is all about addressing imbalances in Pitta dosha, right?
Yeah.
I'm assuming, just like with the other therapies we've discussed, there are certain contraindications for that too, right?
Absolutely. So, for instance, Virachana is not recommended during pregnancy
Okay.
or for individuals experiencing conditions like emaciation or diarrhea.
Right. So again, it's all about tailoring the treatment to the individual's specific needs and making sure that it's actually beneficial for them and safe.
Exactly. Now, the manual refers to Vimana and Virachana collectively as Samshadhana, which highlights their role in purifying the digestive system.
Okay.
And it actually emphasizes the profound benefits of these cleansing therapies. It suggests that they can lead to increased mental clarity, strength and sense organs, improvement in digestion, and even a slowing down of the aging process.
Wow, it's like hitting the reset button on your whole system.
Exactly.
That's pretty amazing. Okay, so we've covered Snahana, Swidana, Vamana, and Virachana.
Right.
We're like halfway through these core Panchakarma therapies.
We are.
What's next on our deep dive?
So we now move on to a very essential procedure known as Vasti, which is, you might be more familiar with the term medicated enema.
Okay, let's talk about Vasti.
Okay.
I know enemas aren't exactly a glamorous topic, but I'm ready to learn more about, their significance in Panchakarma.
Okay, so Vasti is considered one of the most important, if not the most important procedure in Panchakarma.
Wow.
Yeah, it's a highly effective method for delivering medication directly to the colon, where it can be absorbed and utilized more effectively.
So it's more than just like a simple enema. It's about delivering targeted medicine to a specific area.
Exactly. And there are two main types of Vasti, Astapana Vasti, which uses a decoction or herbal tea, and Anuvasana Vasti, which uses a medicated oil.
Okay, so two different types for different purposes, I'm assuming.
Precisely.
Okay, so let's break down those two types of Vasti a little further. What exactly is a Nirvasti?
So Nirvasti is another name for Astapana Vasti,
Okay.
and it involves preparing a decoction from specific herbs that are chosen for their therapeutic properties.
Mm-hmm.
And this decoction is then administered through the rectal route
Okay.
using a specialized apparatus called a Vasti yantra.
So it's like a targeted herbal infusion for the colon.
Exactly.
Yeah, okay.
And what's interesting is that the individual is instructed to maintain a specific posture after the procedure to enhance absorption.
So it's not just about delivering the medicine, it's about creating the optimal conditions for the body to receive and utilize it.
Exactly.
Okay, that makes sense. Very, very mindful and intentional. So contrasting that Nirvavasti, we have Snehavasti, right? So that's the oil-based enema. Tell me more about that.
So Snehavasti, it's all about introducing those therapeutic oils we talked about earlier directly into the colon.
So it's like a deep, nourishing oil treatment, basically, for the lower digestive tract.
Precisely.
Okay.
And the administration process is similar to Nirvavasti, using that same Vasti yantra.
Yeah.
But the key difference, of course, is the use of oil instead of a decoction.
Got it. So what kind of imbalances or conditions would a Snehavasti be used for?
So Snehavasti is particularly beneficial for conditions involving Vata dosha.
Mm-hmm.
And that's, Vata dosha, you probably remember, is associated with movement, air, and space.
Yeah.
And so when Vata is imbalanced, it can manifest as dryness, anxiety, constipation, nervous system disorders.
Okay.
So Snehavasti helps to lubricate and soothe those dry, agitated tissues,
Makes sense.
bringing balance and ease.
It's fascinating how each of these is designed to address a specific set of imbalances. Now the manual also mentions Matravasti. What is that?
So Matravasti is essentially a gentler version of Snehavasti.
Okay.
It involves administering a small dose of medicated oil daily, and it's often recommended for more sensitive individuals, children, elderly.
Okay, so it's like a daily dose of nourishment and lubrication for the colon.
Yeah, gentle and consistent.
Yeah, I love that. Now I know we've talked about like contraindications for some of the other therapies.
Right.
Are there any for Vasti?
Absolutely. So while Vasti is generally a safe and effective therapy when administered correctly,
Yeah.
there are certain conditions where it might not be appropriate.
Okay.
For instance, if someone has a chest injury, is experiencing diarrhea or vomiting, or is pregnant, Vasti is generally avoided.
Right. It's all about personalized care and understanding the individual's current state, and not just, assuming one thing will work for everyone.
Precisely.
It's incredible how like this ancient system takes into account so many, variables.
Right. It really is. It's a testament to the depth and the wisdom of Ayurveda.
Absolutely. So we've covered Snehana, Swidana, Vamana, Virachana, and now Vasti.
Yes.
With all of its, variations.
Right.
We're getting close to the end of these core Panchakarma therapies.
We are.
But we still got one more to go, right?
We do.
So what's next on our deep dive?
So next up is Nasya. And this involves administering medication through the nostrils.
Oh, nasal administration. Okay, interesting. So I'm picturing like those little nasal spray bottle.
Not quite.
Okay.
Nasya is a much more gentle and subtle approach.
Okay.
It involves instilling medicated oils or powders into the nasal passages.
Got it.
And it's particularly effective for addressing imbalanced doshas in the head and neck region.
So it's like a targeted therapy for the upper part of the body.
Precisely. And the nasal passages are considered a gateway to the brain and the nervous system. Yeah. So it can be a really potent tool for addressing a wide range of conditions.
That makes sense. What kind of oils or powders are typically used?
So the manual lists several, including Anutaila, Shirabalataila, and Shadbindutaila, just to name a few.
Okay.
And these oils are chosen for their soothing, nourishing, and balancing properties.
So again, it's not one size fits all. You would pick the specific oil based on the individual.
Exactly.
Okay.
And what's really fascinating is that there are different types of nasya based on the desired action.
Okay.
So you've got like Virachana nasya, which aims to cleanse and eliminate excess doshas.
Mm-hmm.
Then you've got Brahmana nasya, which focuses on nourishing and strengthening the tissues.
Okay.
And Shamana nasya, which seeks to calm and pacify.
So it's like you've got like a toolkit of different nasya techniques.
Precisely. And the manual also describes different ways to administer nasya. So you've got Pratmarsha nasya, which utilizes powders. Marsha nasya involves applying pastes. Avapita nasya uses decoctions. And Dhumapana involves inhaling medicated smoke.
Wow. So many variations. So how is nasya actually like performed?
So it typically involves the individual being seated comfortably, often with their head tilted back slightly. The practitioner might gently massage the head and shoulders to promote relaxation and circulation. And then a measured amount of the medicated oil or powder is instilled into each nostril. Mm-hmm. And the individual is instructed to breathe deeply and hold the medicine in their nasal passages for a few moments to allow for absorption.
It sounds very gentle and relaxing. What kind of conditions would benefit from nasa?
So the manual lists a variety of conditions, including headaches, cervical spondylitis, facial paralysis, sinusitis, and even certain eye conditions.
Wow, that's quite a range.
Yeah.
And of course, there are contraindications too, right?
Absolutely.
Yeah.
So nasya is generally not recommended during pregnancy or for individuals experiencing indigestion. Mm. And again, it's always crucial to consider the individual's current state and consult with a qualified practitioner before undergoing any therapy.
Yeah, safety first.
Okay,
so we've covered Snehana, Swidana, Vamana, Virachana, Vasti, and now nasya.
Yes.
That's all 5 of those core Panchakarma procedures.
That's right.
That's a lot to take in.
It is.
But this manual doesn't stop there. It goes on to detail even more Ayurvedic treatments.
Yeah, it's fascinating. It goes into...
It does. And the next one that it discusses is Abhyanga, which is all about massage.
Right.
Massage. Yeah. Everyone loves a good massage.
Yeah, everyone does.
Tell me all about Abhyanga.
So in Ayurveda, massage isn't just about relaxation, though that is certainly a welcome benefit. Mm-hmm. But Abhyanga involves applying snehadravya to the body using specific techniques.
Snehadravya, that sounds familiar.
It does, right?
Oh.
It means oil and sometimes herbal powders.
Oh, yeah.
We talked about that with Snehana. So Abhyanga is it's about nourishing and lubricating the body. Mm. both internally and externally. But now we're incorporating touch and specific massage techniques.
So it's like taking those principles of Snehana and applying them through massage.
Exactly.
Okay. And the benefits of Abhyanga are numerous, right? Like I'm guessing it helps improve circulation, relaxes muscles, nourishes the skin, all that good stuff.
Yeah, absolutely. All of the above. It helps to improve circulation, relax muscles, nourish the skin. It also helps to calm the nervous system, promote overall well-being.
I can already feel myself relaxing just thinking about it. So what kinds of oils are typically used for Abhyanga?
Yeah, so the manual, again, lists several familiar oils. Sesame oil, Mahanarayana Taila, Shirabella Taila, Tanwantara Taila, and Bala Taila. Again, these oils are chosen for their nourishing, lubricating, and therapeutic properties.
So those same oils that we talked about for Snehana are also being used for Abhyanga. It's like this consistent thread of nourishment throughout these therapies.
Precisely.
Okay. And here's an interesting fact from the manual that I thought was kind of cool. It says that the oil used for Abhyanga can be reheated and reused for several days.
Yeah, that's a really cool point.
Which I thought was really interesting. It speaks to the practicality and the sustainability of this ancient practice, right?
Exactly.
Reduce, reuse, recycle, even in Ayurveda. So walk me through like what happens during an Abhyanga session.
Okay, so the procedure emphasizes using warm oil, applying gentle rhythmic strokes, and covering the entire body.
Okay.
From head to toe.
Okay.
And it's a very mindful and intentional practice. And the manual actually even details specific strokes and techniques for different areas of the body.
So it's like this beautiful blend of art and science.
Exactly.
And the manual also mentions post-operative procedures.
Right.
For Abhyanga, right?
Yeah.
So what does that entail?
So this involves resting for a period of time after the massage, allowing the oil to fully absorb and the body to kind of integrate the benefits.
Okay.
The manual also recommends bathing with warm water and adhering to specific dietary recommendations, such as consuming light and easily digestible foods.
So it's not just about the massage itself. It's about supporting the body's natural healing processes afterward.
Exactly.
Okay. And now, while Abhyanga is generally beneficial for most individuals, there are, as always, certain contraindications.
Right.
So who might want to avoid Abhyanga?
So the manual specifically mentions acute fever and indigestion
Okay.
as conditions where Abhyanga would not be recommended. Again, it's about understanding the individual's current state and choosing therapies that support rather than disrupt their healing process.
That makes sense. So we've explored Snehana, Swidana, Vamana, Virachana, Vasti, Nasya, and Abhyanga. We've covered all those core Panchakarma therapies, plus a bonus massage.
Yeah.
So what's next on our deep dive into this manual?
So the manual goes on to detail several other Ayurvedic therapies, starting with specific procedures that are designed to target certain areas of the body.
Okay, so we're getting even more specific and targeted now.
Exactly.
Okay, I'm excited to learn more. What's the first one on that list?
Okay, so the manual starts with Shiravasti, which, as the name suggests, focuses on the head.
Okay.
Shiro means head, and Vasti, you remember, refers to that retaining process that we talked about earlier.
Okay, so we're retaining something on the head.
Yes.
So what exactly are we retaining?
So Shiravasti involves retaining warm medicated oil over the head for a specific period of time.
Okay.
And it's considered a type of murd. And it's considered a type of murda taila, which means applying oil to the head.
So it's like an intensive oil treatment for the head.
Precisely. And it's particularly beneficial for addressing imbalances in vata dosha in the head region.
Okay, so we're nourishing and lubricating the head with these therapeutic oils. What does that procedure involve?
So it involves creating a well on the head.
Okay.
And this is done using a specially constructed cap.
Okay.
It's made from leather or cloth.
Okay.
The base of the cap is sealed with black gram flour paste
Okay.
to prevent leakage. And then warm medicated oil is slowly poured into the well, essentially bathing the scalp and hair in those nourishing oils.
I can already feel the tension melting away. So what kind of conditions would benefit from Shiravasti?
It's often recommended for, conditions like headaches, migraines, insomnia, hair loss, premature graying of hair, dryness of the scalp, anxiety, and even certain neurological conditions.
Wow, that's quite a range. And I'm guessing like with all these therapies, there's certain contraindications for this too, right?
Absolutely.
Yeah.
So Shiravasti is generally not recommended for individuals experiencing acute inflammatory conditions in the head region, as well as those with certain eye diseases. It's always, always crucial to consult with a qualified Ayurvedic practitioner to determine if Shiravasti is an appropriate therapy for you.
Right, because what might be beneficial for one person could be detrimental to another.
Exactly.
It's all about that personalized approach. Okay, so we've got Shiravasti, the head-focused therapy. What's next on the list of specific procedures?
Next, we have Kadivasti, which targets the lower back region.
Kanivasti, referring to the waist or the lower back area,
You
right?
got it. So Kadivasti is similar to Shiravasti in that it involves retaining warm, medicated oil. But this time, the focus is on the lumbosacral region. That's the area of the lower back that includes those 5 lumbar vertebrae and the sacrum.
Okay, so we're essentially applying that same principle of retaining the warm oil, but to a different area of the body. So what's the purpose of Kativasti? What's it used for?
So Kadivasti is incredibly beneficial for nourishing and lubricating the lower back, which is often a site of, you know, tension, pain, and stiffness. It helps to alleviate lower back pain, sciatica, stiffness. It's also used to address imbalances in Vata dosha in this region, promoting flexibility, strength, and stability.
I'm starting to see how these specific therapies are like designed to target those particular areas of the body and address like localized imbalances.
Precisely.
Okay, cool. And the procedure for Kadivasti is it pretty similar to Shiravasti?
It is. So a well is created on the lower back.
Mm-hmm.
And this is done using black gram flour dough.
Okay.
And then this well is sealed to prevent leakage, and warm medicated oil is carefully poured in, creating a soothing and therapeutic pool of warmth and nourishment.
So we're essentially creating like a little oil bath for the lower back.
Exactly.
I love that. What kind of oils are typically used for that?
So the manual mentions several familiar oils. You've got Mahanarayana Kaila, Shirabala Taila, and Dhanavantara Taila, all chosen for their nourishing and lubricating properties, as well as their ability to pacify Vata dosha.
Those same oils just keep popping up. It's like they're like the all-stars of these Ayurvedic therapies.
They truly are. They're incredibly versatile, right?
Yeah.
They have such a wide range of applications.
Yeah.
And they're so beneficial for restoring balance and harmony to the body.
Okay, so we've got Kativasti for the lower back. What other areas of the body do this specific procedures target?
So next on the list is Urovasti, which you might have guessed focuses on the chest.
Uro meaning chest. Okay, so if Kapivasti is for the lower back and Urovasti is for the chest, are the procedures similar?
They are very similar. So Urovasti involves retaining warm medicated oil over the chest region. And again, this is done using a well that's constructed from black gram flour dough, just like Kadivasti. It's all about delivering that warmth, nourishment, and lubrication to those specific areas of the body.
I'm seeing a pattern here. Create a well, seal it, pour in the warm oil, let it work its magic.
Exactly. And the benefits of Urovasti are similar to Kadivasti. You know, it's great for relieving chest congestion, tightness, pain, especially in individuals who are experiencing respiratory issues or anxiety.
Okay.
And it's also used to address imbalances in Vata and Kapha dosha in the chest region, promoting healthy lung function and emotional well-being.
Okay, so we've addressed the head, lower back, and chest. What other areas does the manual cover?
So next up, we have Tarpana, which focuses on the eyes.
The eyes. Okay, now I'm really intrigued. What does Tarpana mean?
So Tarpana means to nourish or to satiate. And in this context, it refers to retaining medicated ghee over the eyes. And this is done to nourish and rejuvenate those delicate tissues.
Medicated ghee for the eyes. It sounds a bit messy, but I'm trusting that there's a method to the madness.
There absolutely is. And don't worry, it's not as messy as it sounds. So the procedure involves creating a well around the eyes. And this well is made using black gram flour dough.
Okay.
And then this well is filled with warm medicated ghee, and the eyes are gently closed, allowing the ghee to bathe and soothe them.
So it's like a ghee bath for the eyes. I love it.
It is. It's a wonderfully soothing and nourishing therapy.
So what kind of conditions would benefit from Tarpana?
So it's often used to address dry eyes, eye strain, blurred vision, conjunctivitis, and even certain inflammatory conditions of the eyes. It's also incredibly beneficial for promoting relaxation, reducing stress, improving sleep quality.
Wow, so it's not just about the physical health of the eyes, it's about those emotional and mental benefits as well.
Precisely. Ayurveda recognizes that interconnectedness, right?
I love that. Now, the manual also mentions Akshi Tarpana. Is that different from Tarpana?
It is. So Akitarpada is a more specialized eye treatment. It involves using a smaller dough well, and the ghee is infused with rose petals, which adds this cooling and soothing element to the therapy.
Okay, so it's like a more targeted, refined version of Tarpana, specific for the eyes.
Exactly.
Okay, so we've covered Shiravasti for the head, Kadivasti for the lower back, Uravasti for the chest, and Tarpana and Akshitarpana for the eyes. What's next on our Ayurvedic adventure?
So next we have Griva Basti, which you might guess from the name, focuses on the neck region.
Griva, meaning neck, right?
You got it. So Griva Basti is similar to Kadivasti and Uravasti in that it involves retaining warm medicated oil, but this time the focus is on the cervical region. That's the area of the neck that includes those 7 cervical vertebrae.
Okay, so we're creating that same warm oil pool, but on the neck. What are the benefits of Griva Basti?
So Griva Basti is incredibly beneficial for nourishing and lubricating those cervical vertebrae, relieving neck pain, stiffness, and tension. It's also used to address imbalances in Vata dosha in the neck region, promoting flexibility, range of motion, overall well-being.
It sounds like a great therapy for anyone who spends a lot of time hunched over a computer or a phone.
It certainly is, and the procedure is very similar to those other Vasti therapies we've discussed. A well is created on the back of the neck using black gram flour dough. This well is sealed to prevent leakage, and warm medicated oil is carefully poured in, creating that soothing and therapeutic pool of warmth and nourishment.
Okay, I think I'm starting to get the hang of these Vasti therapies. They're all about delivering that targeted warmth and nourishment to specific areas of the body.
You got it.
Okay, cool. So we've addressed the head, the lower back, chest, eyes, and neck. What other areas of the body do these specific procedures target?
Well, the next procedure in the manual is a bit different. It's called Janobira Pindaswita, and it involves using a kind of a unique ingredient, lemons.
Lemons. I'm intrigued. Tell me more about Janobira Pindaswita.
Okay, so Janobira refers to lemons, and Pindaswita indicates a type of heat therapy that utilizes boluses.
Okay.
And boluses are essentially like small bundles of herbs or ingredients.
Got it.
So in this case, we're talking about using boluses made from lemons to apply heat to the body.
Okay, I'm trying to picture this. So how are these lemon boluses used in Janobira Pindaswita?
So it involves cooking pieces of lemon with specific herbs
Okay.
and then tying them up in a cloth to form those boluses. These boluses are then dipped in warm medicated oil and applied to the affected areas with gentle pressure.
So we're combining the therapeutic properties of the lemon and the herbs with the heat from the boluses and the oil. What kind of conditions would Janobira Pindaswita be used for?
So it's often used for conditions involving pain, stiffness, and inflammation in the joints and muscles. So, things like frozen shoulder, arthritis, sports injuries. The warmth from the boluses helps to relax the muscles, increase circulation, while those lemons and herbs provide additional therapeutic benefits.
It's amazing how this ancient system utilizes these readily available ingredients like lemons,
Right.
to create these powerful therapies.
Yeah, it really is.
And the manual even lists the specific herbs that are typically included in the boluses, right? Like ginger, turmeric, garlic.
Yes, it does.
Oh,
Exactly.
Yeah.
All known for their anti-inflammatory properties.
okay. So we've got Janobira Pindaswita using those lemon boluses. What's next?
So next we move back into the realm of Swidana
Okay.
with Nadi Swita, which you might recall is a type of sudation or sweating therapy.
So we're back to sweating. Tell me more about Nadi Sweat.
Okay, so Nadi Swita involves directing steam that's generated from boiling liquids
Yep.
to specific areas of the body. So it's a localized approach to Swidana.
Got it.
And this is done using a specialized apparatus called a Nadi Yantra.
Okay.
And this apparatus, it consists of a chamber where the liquids are boiled and then a pipe or a nadi through which the steam is channeled.
Okay, so we're targeting those specific areas with this steam therapy. What kinds of liquids are boiled to create the steam?
Typically, it involves boiling water that's infused with herbs.
Okay.
And these herbs are specifically chosen for their therapeutic properties. The manual mentions common herbs like castor root, dashmula, which is a combination of 10 roots,
Okay.
and rock salt, all known for their ability to alleviate pain, reduce inflammation, and promote circulation.
So it's like a targeted herbal steam bath.
Precise.
Okay, and what kind of conditions would Nadi Sweta be used for?
So it's often recommended for conditions affecting the muscles, joints, and nerves. Things like arthritis, muscle spasms, sciatica, and even paralysis. The localized application of the steam helps to penetrate deep into those tissues, promoting relaxation, reducing pain, and improving mobility.
It's amazing how these ancient therapies, like, they address both the physical and the energetic aspects of healing. Now, are there any situations where Nadi Sweta might not be recommended?
Of course. So, like with any of these therapies, there are contraindications.
Okay.
For instance, Nadi Sweta is generally not recommended during pregnancy, acute fever, or for individuals with open wounds or skin infections in the area being treated.
Right. It's always about using discernment and choosing therapies that are appropriate for the individual's current state.
Precisely. Now, the manual also describes another kind of fascinating Swedana therapy called Lavana Pinda Sweta, which utilizes a very common ingredient, rock salt.
Rock salt. I'm intrigued. So how does Lavana Pinda Sweta work?
So it's a dry heat therapy that involves heating rock salt and then tying it up in a cloth to form those boluses that we talked about earlier. These warm salt boluses are then applied to the affected areas, delivering this deep penetrating heat.
Okay.
That helps to loosen up stiff muscles and joints, reduce inflammation, improve circulation.
So it's like a hot stone massage, but with rock salt instead of stones.
Yeah, exactly.
Okay. And what kind of conditions would Lavana Pinda Sweta be used for?
So it's often recommended for conditions involving kapha and vata dosha.
Okay.
So things like arthritis, muscle spasms, obesity, and edema.
Uh-huh.
The warmth and the drying properties of that rock salt help to balance those doshas and alleviate those associated symptoms.
Makes sense. And I see here that the manual lists contraindications for Lavana Pinda Sweta too, right?
It does, yeah.
Including acute inflammatory conditions, open wounds, and pregnancy. So it seems like any kind of intense heat therapy is approached with caution, especially during pregnancy.
You're absolutely right. It's all about understanding the individual's constitution and making sure that the treatment is appropriate and safe.
Okay, cool. So speaking of specific types of Swedana, what is Kshira Duma?
Okay, so Kshira Duma is a kind of a unique treatment that utilizes the healing properties of milk. So Kshira means milk, and Duma refers to smoke or vapor.
Okay, so it involves milk and steam.
Precisely. So it's a type of sudation therapy
Okay.
where steam is generated from boiling milk and specific herbs.
Okay.
And this medicated steam is then directed towards the body using a specialized apparatus.
Wow, it sounds like a very nourishing and gentle form of heat therapy.
Yeah.
Like, what kind of conditions would Kshira Duma be used for?
So it's often used for certain skin conditions.
Okay.
Like dryness, itching, and also for some eye conditions. It's also believed to be beneficial for calming the nervous system and promoting relaxation.
Interesting. And of course, there are contraindications, right? Eye disorders and pregnancy are mentioned here.
Right. As always, it's about careful consideration and personalized care.
Okay, so we've got Kshira Duma using the milk steam. What's Kshira Dupana?
So Kshira Dupana is very similar to Kshira Duma.
Okay.
So both utilize that medicated milk steam, but the method of generating the steam is slightly different.
Interesting. So it's like a variation on the Kshira Duma theme.
Exactly.
Okay. Moving on to the next specific procedure, what is Shirbo-Pichu?
Okay, so Shirbo-Pichu involves applying medicated oil to a very specific point on the head called the anterior fontanelle.
Okay.
And this is the soft spot on a baby's head that eventually closes, but it remains kind of a sensitive area in adults, and it's energetically connected to the brain and the nervous system.
Interesting. So it's a very targeted application of oil to a specific energy point.
Precisely. So a cotton pad is soaked in that medicated oil, and then it's placed on the anterior fontanelle, and the oil is allowed to absorb into the scalp, nourishing and calming that nervous system.
Okay, I'm trying to picture this. So the cotton pad is like a little oil reservoir, right?
Yeah.
It's sitting right on that specific spot on the head. What kind of conditions would Shirbo-Pichu be used for?
So it's often recommended for hair fall, premature graying, headaches, insomnia, anxiety, and certain neurological conditions. Um, it's a very gentle and effective therapy for calming the mind, promoting relaxation, and improving sleep quality.
Fascinating. And I see here that the contraindications listed include pregnancy, traumatic conditions, and certain pitta disorders.
Right. As always, it's about understanding the individual's needs and ensuring that the treatment is appropriate.
Okay, so we've got Shiropichu using that targeted oil application. What's Udvartan?
So Udvartana is a stimulating massage therapy
Okay.
that involves using herbal powders and sometimes oils to invigorate the body, improve circulation, and promote detoxification.
Okay, so it's a massage, but it sounds a bit different from Afhyanga. What makes Udvartana unique?
So unlike Afhyanga, where the strokes are, gentle and flowing, Udvartana involves more vigorous strokes that go against the direction of hair growth.
Okay.
So it's an exfoliating and invigorating massage that helps to stimulate the lymphatic system, improve circulation, and remove toxins from the body.
So it's like a detoxifying and invigorating massage.
Exactly.
Okay. And are there specific powders or oils that are used for Udvartana?
Yes, there are. So the manual mentions several herbal powders that are commonly used for Udvartana, including Kolakulatadi Churna, which is a blend of herbs known for their rejuvenating and detoxifying properties, and then Triphala Churna, which is a combination of 3 fruits that are renowned for their cleansing and balancing effects. And these powders are often mixed with a small amount of oil, such as like sesame oil or coconut oil, to create a paste
Okay.
that's then applied to the body.
So we're combining those stimulating effects in the massage with the therapeutic properties of those herbal powders.
Exactly.
What kind of conditions would benefit from Udvartana?
So Udvartana is often recommended for weight management, as
Yeah.
it helps to stimulate metabolism and break down fat.
Okay.
It's also beneficial for improving circulation, reducing cellulite, toning the skin, and addressing conditions like obesity and lymphatic congestion.
Okay. So it's like a natural way to boost your metabolism and detoxify your body.
Exactly.
And of course it lists contraindications too, including acute fever and pregnancy.
Right. It's all about personalized care and ensuring the treatment is appropriate and safe.
So we've explored all these specific procedures from head to toe, targeting specific areas of the body, addressing various imbalances. It's incredible how detailed and comprehensive this system is. But what happens after someone completes a Panchakarma treatment? Like, I'm imagining there's more to it than just, going back to your regular routine.
You're absolutely right. So that's where Panchakarma comes in, which essentially means post-treatment regimen.
Okay.
It's an integral part of the Panchakarma process, and it plays a crucial role in stabilizing the benefits of the treatments, preventing complications, and ensuring long-lasting results.
Okay, so it's like the aftercare instructions.
Exactly.
What does Panchakarma involve?
So it involves a gradual return to a normal diet, a process known as Piyati Samsarjana Karma.
So we're not just jumping back into our regular eating habits right away.
Not quite.
Mm-hmm.
So the idea is to gently reintroduce foods, starting with those that are light, easily digestible, and nourishing for that digestive system. So, think simple, cooked foods, rice, khichari soups. And as the digestive fire strengthens, we gradually increase the complexity and variety of foods, eventually returning to a balanced and wholesome diet that's tailored to the individual's constitution.
Makes sense. You need to give the digestive system a chance to rest and reset after those deep cleansing therapies.
Exactly. And Panchakarma also involves following Pathya, which refers to a set of, wholesome practices and guidelines that support overall health and well-being.
So it's not just about the food we eat, it's about our lifestyle choices as well.
Precisely. So Pathya includes dietary recommendations, of course, but it also encompasses lifestyle adjustments, things like establishing regular sleep patterns, incorporating gentle exercise into the routine, and managing stress through practices like meditation and yoga. It's about nurturing ourselves on all levels, physical, mental, and emotional, to support that healing process and maintain those positive changes that we've cultivated through Panchakarma.
So it's a holistic approach to post-treatment care.
Absolutely. Now, the manual also mentions observing brahmacharya, during Panchakarma.
Brahmacharya.
Yeah, so brahmacharya means celibacy, or more broadly, moderation in all sensory activities.
Okay.
So the idea is to conserve energy and avoid overexertion or overstimulation, allowing the body to focus on healing and rejuvenation.
So it's about creating a sense of stillness and allowing the body to integrate those deep changes.
Precisely. And it's not, it's not just about celibacy. It's about, being mindful of all of our sensory experiences,
Yeah.
and ensuring that they're nourishing and supportive rather than depleting or overwhelming.
That makes sense. It's about creating a supportive and nurturing environment for our bodies and our minds to thrive. So to summarize, Panchakarma is about gradually returning to a normal diet, following those wholesome guidelines, and cultivating a sense of stillness and moderation in our lives.
You got it. It's all about honoring the wisdom of our bodies and supporting them in their natural healing journey.
This deep dive into the Panchakarma SOP manual has been incredibly insightful. We've covered so much ground, from the foundational principles of Ayurveda to those intricate details of those 5 core Panchakarma therapies, plus all those additional supportive therapies.
It's a testament to the depth, the complexity, the brilliance of this ancient healing system.
I'm truly amazed by the level of detail and personalization involved in each of these therapies. It's not just about applying a remedy, it's about understanding the individual's unique constitution, imbalances, and needs, and creating a personalized treatment plan to restore balance and harmony.
Couldn't have said it better myself.
Mhm.
It's not a one-size-fits-all approach. It's a deeply individualized and holistic system that recognizes that interconnectedness of the mind, body, and spirit.
And this manual has given us like such a clear and comprehensive overview of these powerful therapies, but I can't emphasize enough like the importance of consulting with a qualified and experienced Ayurvedic practitioner before embarking on any Panchakarma journey.
Absolutely. This manual is a fantastic resource, but it's not a substitute for the expertise and the guidance of a trained professional.
Right. It's like having a map versus having an experienced guide. The map can give you a general overview, but the guide can help you navigate the terrain, avoid pitfalls, discover hidden treasures along the way.
What a perfect analogy.
So for our listener who's clearly fascinated by the world of Ayurveda, what would you say is the most important takeaway from this deep dive into Panchakarma?
I would say the key takeaway is that Panchakarma is not just about cleansing the body. It's about restoring balance, harmony, and vitality to our entire being, mind, body, and spirit. It's a profound journey of self-discovery and healing that can lead to lasting transformation.
Beautifully said. And for those who are eager to learn more, I would highly recommend exploring resources like the National Institute of Ayurveda and connecting with qualified Ayurvedic practitioners in their area.
Excellent suggestions. There's a wealth of knowledge and wisdom waiting to be discovered within the realm of Ayurveda.
Now, this deep dive has focused specifically on Panchakarma, but I know there's so much more to Ayurveda than just these cleansing therapies.
You're right. Panchakarma is just one aspect of this vast and comprehensive healing system. Ayurveda encompasses a wide range of practices and principles that can be incorporated into our daily lives to promote health, well-being, and longevity.
So it's not just about, going on a retreat or doing a cleanse. It's about embracing a lifestyle that supports our overall health and vitality.
Precisely. Ayurveda offers practical guidance on everything from diet and lifestyle to sleep and stress management, all tailored to our individual constitution and needs.
It's like having a personalized roadmap to optimal health and well-being.
Exactly.
Okay, I'm already brainstorming ideas for our next deep dive into the world of Ayurveda.
Awesome.
But for now, let's shift gears and explore some of those specific procedures that are outlined in the manual. So we've already talked about Shiravasti, Kadivasti, Uravasti, Tarpana, Akshitarpana, and Grivabasti.
Right. So those therapies that involve retaining warm medicated oil on different parts of the body.
Exactly. So what other fascinating procedures does this manual have in store for us?
Well, the next procedure is called Janobirapinda Swita. And it utilizes a kind of rather unique ingredient, lemons.
Lemons. I love it. Tell me everything about Janobir Pindaswita.
Okay, so Janobir refers to lemons, and Pindaswita indicates a type of heat therapy that utilizes boluses,
Okay.
which are essentially like small bundles of herbs wrapped in cloth.
Okay.
So in this case, we're talking about using boluses made from lemons to apply heat to specific areas of the body.
Okay, so it's like a hot compress, but with lemons.
Precisely. And what's fascinating is that these lemon boluses are prepared by cooking pieces of lemon with specific herbs that are chosen for their therapeutic properties.
Okay.
These boluses are then dipped in warm, medicated oil and applied to the affected areas with gentle pressure.
So we're combining the therapeutic benefits of the lemons and the herbs with the heat from the boluses and the nourishing properties of the oil. What what kind of what kind of conditions would Janubira pindasuida be used for?
So it's often recommended for conditions involving pain, stiffness, and inflammation in the muscles and joints.
Okay.
Think arthritis, frozen shoulder muscle
Right.
spasms, even sports injuries.
Got it. So it sounds incredibly soothing and therapeutic.
It is.
And the manual even lists specific herbs that are used in the boluses, right? Like ginger, turmeric, garlic.
Yes, it does.
Wow.
Exactly. All known for their anti-inflammatory properties.
Okay.
And the specific herbs would be chosen, based on the individual's needs and the desired therapeutic effects.
So there's that element of personalization. Again, it's not just about applying a standard formula. It's about tailoring the treatment to the individual's unique needs.
Exactly. Now, while Janibira pindasuida is generally safe and effective,
Hmm.
there are certain contraindications, such as pregnancy, acute inflammation, open wounds, and skin infections. It's always crucial to consult with a qualified Ayurvedic practitioner to determine if this therapy is appropriate for you.
Right, because even though we're, using natural ingredients like lemons, these therapies can be quite potent and it's important to use them wisely.
Absolutely.
Oh.
Now let's move on to another fascinating therapy mentioned in the manual, Nadi Sweta, which is another type of sudation or sweating therapy that we touched upon earlier.
Ah, so we're back to sweating. I'm ready to learn more about Nadi Sweta.
Okay, so Nadi Sweta involves directing medicated steam to specific areas of the body
Okay.
using a specialized apparatus called a Nadi Yantra.
Okay, so it's like a targeted steam bath.
Precisely. The Nadi Yatra consists of a chamber where water is boiled, often with specific herbs, and a pipe or a nadi to which the steam is directed to the affected area.
Okay, so we're delivering those therapeutic vapors directly to where they're needed. What kind of conditions would Nadi Sweta be used for?
So it's often recommended for conditions involving pain, stiffness, and inflammation in the muscles and joints, similar to Janibira pindasuida.
Okay.
Think arthritis, muscle spasms, sciatica, even paralysis. The localized application of the steam helps to penetrate deep into the tissues, relaxing those muscles, reducing inflammation, improving circulation.
It sounds like a very effective way to alleviate pain and promote healing. And I'm guessing the choice of herbs that are used in the steam would depend on the specific, condition being treated.
Absolutely. The manual mentions common herbs like castor root mula, which is a combination of 10 roots and rock salt, all known for their analgesic, anti-inflammatory, and circulatory stimulating properties.
Okay.
The specific combination of herbs would be tailored to the individual's needs and the desired therapeutic effect.
So once again, we see that element of personalization. It's not a one-size-fits-all approach. It's about understanding the individual's unique needs and creating a treatment plan that addresses those needs.
Precisely. And just like with other Sweetana therapies, there are certain contraindications for Nadi Sweta. For instance, it's generally not recommended during pregnancy, acute fever, or for individuals with open wounds or skin infections in the area being treated.
Right. It's always about proceeding with caution and making sure that the therapy is both safe and beneficial.
Now, moving on to another unique Sweetana therapy. The manual describes Lavana pindasuida, which utilizes a very common ingredient, rock salt.
Rock salt. Okay, so we're using rock salt to induce sweating. How does that work?
So Lavana pindasuida is a dry heat therapy that involves heating rock salt
Okay.
and then tying it up in a cloth to form those boluses that we talked about earlier.
Right.
These warm salt boluses are then applied to the affected areas, delivering this deep penetrating heat
Okay.
that helps to loosen up those stiff muscles and joints, reduce inflammation, improve circulation.
So it's like a hot stone massage, but with rock salt instead of stones.
Exactly.
Okay. And what kind of conditions would Lavana pindasuida be used for?
So it's often recommended for conditions involving kapha and vata dosha.
Okay.
So things like arthritis, muscle spasms, obesity, and edema. The warmth and the drying properties of that rock salt help to balance those doshas and alleviate those associated symptoms.
It's fascinating how this ancient system utilizes like simple, readily available ingredients like rock salt to create these powerful therapies.
It really is a testament to the wisdom and ingenuity of Ayurveda. And just like with the other therapies we've discussed, Lavana pintasweeta has contraindications.
Okay.
For instance, it's generally not recommended during pregnancy for individuals experiencing acute inflammation or for those with open wounds or skin infections in the area being treated.
Right. Safety first always. It seems like a recurring theme in Ayurveda is this deep respect for the body's innate intelligence and the understanding that not every therapy is suitable for every individual or every situation.
You've hit the nail on the head. It's about listening to the body's wisdom
Yeah.
and working with it, not against it.
I love that. Now the manual also delves into two intriguing therapies that utilize milk. Kshiroduma and Kshirodupana.
You're right. Kshira, as you might recall, means milk.
Mm-hmm.
And both of these therapies harness the nourishing and soothing properties of milk to promote healing and well-being.
Okay, so let's break these down. What is Kshiroduma?
Kshiroduma involves generating medicated steam from boiling milk and specific herbs.
Okay.
This gentle steam is then directed towards the body using a specialized apparatus, delivering the soothing and nourishing warmth.
So it's like a milk-infused steam bath.
Pretty much.
What kind of conditions would Kshiroduma be used for?
So it's often recommended for certain skin conditions such as dryness, itching, eczema.
Okay.
It's also used for some eye conditions like dry eyes, conjunctivitis, and it's believed to be beneficial for calming the nervous system and promoting relaxation.
Interesting. So it's a very gentle and nourishing therapy with a wide range of applications. And the manual mentions contraindications for Kshiroduma, right?
It does. Kshiroduma is generally not recommended for individuals with certain eye disorders or during pregnancy.
Okay, so as always, it's about using discernment and consulting with a qualified practitioner to determine if this therapy is appropriate. Now, what about Kshirodupana? How does that differ from Kshiroduma?
Kshirodupana is very similar to Kshirodupana in that it also utilizes medicated milk steam. The main difference lies in the method of generating the steam.
Okay.
In Kshirodupana, the steam is produced by pouring the medicated milk onto heated iron or stones, creating this fragrant and therapeutic vapor.
So it's like a more concentrated and intense form of milk steam therapy.
You could say that. And it's often used for similar conditions as Kshiroduma, particularly for skin conditions and respiratory issues.
Interesting. So two variations on the milk steam theme, each with its unique method and application. Now, the manual also mentions a very targeted therapy called Shiro-Pichu. Can you tell me more about that?
Of course, Shiro-Pichu involves applying medicated oil to a very specific point on the head,
Okay.
called the anterior fontanelle. And this is the soft spot on a baby's head that eventually closes,
Right.
but it remains a sensitive area in adults.
Okay.
And it's energetically connected to the brain and the nervous system.
So it's a very precise application of oil. Why is the anterior fontanelle chosen as the site for this therapy?
So in Ayurveda, the anterior fontanelle is considered an energy point that's closely connected to the brain and the nervous system.
Okay.
So by applying medicated oil to this point, we can influence the flow of energy
Got it.
and promote balance and harmony within that nervous system.
That makes sense.
Yeah.
So it's like acupressure, but with oil.
Mm.
What kind of conditions would benefit from Shiro-Pichu?
So Shiro-Pichu is often recommended for conditions related to the head and the nervous system. So things like headaches, migraines, insomnia, anxiety, hair loss, premature graying of hair, and even certain neurological conditions. It's a very gentle and effective therapy for calming the mind, promoting relaxation, and improving sleep quality.
It sounds like a wonderful therapy for anyone who struggles with stress or anxiety or sleep issues. And the manual mentions certain oils that are commonly used for Shiro-Pichu, right?
It does. Common oils include Brahmi oil, Bhringaraj oil, and sesame oil, all known for their calming, nourishing, and rejuvenating properties.
Yeah.
And the specific oil would be chosen based on the individual's needs and the desired therapeutic outcome.
So again, we see that element of personalization. Now, are there any contraindications for Shiro-Pichu?
Yes, just like with the other therapies we've discussed, Shiropichu is not suitable for everyone. The manual lists contraindications, including pregnancy traumatic conditions and certain PITA disorders. It's crucial to consult with a qualified Ayurvedic practitioner to determine if Shiropichu is appropriate for you.
Right. It's always about approaching these therapies with respect and discernment, understanding that they're powerful tools that should be used wisely and under the guidance of a qualified practitioner.
Absolutely. Now, let's shift gears and explore another fascinating therapy mentioned in the manual, Udvartana, which is a type of massage that utilizes herbal powders and sometimes oils.
Okay, so we're back to massage. How does Udvartana differ from Abhyanga, the oil massage we discussed earlier?
So Udvartana is a stimulating and invigorating massage
Okay.
that involves using herbal powders
Okay.
and sometimes oils to exfoliate the skin, improve circulation, and promote detoxification.
Okay.
Unlike Abhyanga, where the strokes are gentle and flowing, Udvartana involves more vigorous strokes that go against the direction of hair growth.
Okay.
It's a more intense massage that helps to stimulate the lymphatic system, break down fat, and remove toxins from the body.
So it's like a deep tissue massage with the added benefits of those herbal powders.
Exactly.
Okay. And the manual mentions specific powders that are used for Udvartana, right? What are some of those?
Yeah, common powders include Kulakulatati Churna, which is a blend of herbs known for their rejuvenating and detoxifying properties.
Okay.
And then Truffula Churna, which is a combination of 3 fruits that are renowned for their cleansing and balancing effects.
Okay.
And these powders are often mixed with a small amount of oil, like sesame oil or coconut oil, to create a paste that's then applied to the body.
So we're combining the stimulating effects of the massage with the therapeutic properties of those herbal powders.
Yeah.
What kind of conditions would benefit from Udvartana?
So Udvartana is often recommended for weight management,
Yeah.
as it helps to stimulate metabolism and break down fat.
Yeah.
It's also beneficial for improving circulation, reducing cellulite, toning the skin, and addressing conditions like obesity and lymphatic congestion.
It sounds like a great therapy for anyone looking to boost their metabolism, detoxify their body, and improve their overall health and well-being.
It is. And just like with the other therapies we've discussed, Udvartana has contraindications such as pregnancy, acute fever, open wounds, and skin infections.
Yeah.
It's always important to consult with a qualified Ayurvedic practitioner to determine if this therapy is right for you.
Right. It's always about using discernment and choosing therapies that are appropriate for our individual needs and circumstances. Now, this deep dive into the Panchakarma SOP manual has been incredibly insightful.
Okay.
We've covered so much ground from those foundational principles of Ayurveda to the intricate details of those 5 core Panchakarma therapies and all these additional supportive therapies.
It's been a fascinating journey through the wisdom and practices of this ancient healing system.
I'm so impressed by the level of detail, personalization, and holistic understanding that's embedded in this system. It's not a quick fix or a Band-Aid solution. It's a profound journey of self-discovery and healing that addresses those root causes of imbalance and promotes lasting well-being.
Beautifully said. And that this manual is a treasure trove of information.
It really is. It gives us a glimpse into the depth and the complexity of Panchakarma and the meticulous care and attention that goes into these therapies. But I want to reiterate the importance of working with a qualified and experienced Ayurvedic practitioner before embarking on any Panchakarma journey. This manual is a fantastic resource, but it's not a substitute for the expertise and the guidance of a trained professional.
Absolutely. A skilled practitioner can assess your individual needs, create a personalized treatment plan, and safely guide you through each step of the process, ensuring you receive the most appropriate and beneficial therapies.
Right. It's about working in partnership with a practitioner who understands your unique constitution, imbalances, and goals, and who can help you navigate this transformative journey with with wisdom and compassion.
Couldn't agree more.
So for our listener who has clearly embarked on their own journey of discovery into the world of Ayurveda, what would you say is the most important takeaway from this deep dive into Panchakarma?
I would say the key takeaway is this. Panchakarma is not just about cleansing the body. It's about restoring balance, harmony, and vitality to our entire being, mind, body, and spirit. It's a profound process of purification, rejuvenation, and transformation that has the potential to awaken us to our own innate healing capacity and lead us to a life of greater health, well-being, and fulfillment.
Beautifully said. And for those who are eager to learn more, I would highly recommend exploring resources like the National Institute of Ayurveda and connecting with qualified Ayurvedic practitioners in their area. There's a wealth of knowledge and wisdom waiting to be discovered within the realm of Ayurveda, and Panchakarma is just one gateway into this extraordinary healing system.
Well said.
Well, on that note, I think it's time to wrap up this deep dive. Thank you so much for joining us on this fascinating journey into the world of Panchakarma.
It's been an absolute pleasure sharing this wisdom with you and our listener.
Until next time, may you be well and thrive.